Evidence-based treatment of patellofemoral pain. So how do we actually treat these patients with patellofemoral pain? These treatments are coming from a study, Winter et al. In 2020. I'll leave that link in the show notes if you want to check it out. So what they were looking at was all treatments found to be more effective than wait and see. So wait and see is basically, we've diagnosed you with patellofemoral pain. Now we're going to let you go and do whatever the heck you want to do, and we're not going to intervene whatsoever. Okay. Now, this actually works fairly well in some pathologies. I think lumbar radiculopathy is one of those ones, right? Radicular pain in the low back. However, that's not necessarily the case with patellofemoral pain. As I said earlier, having patellofemoral pain is one of those things that can be recalcitrant and not get better with time. Okay. So in this study, what did they find was helpful for treatment of the patellofemoral pain? What was helpful beyond wait and see? Well, the first one was education. Okay. And with education, generally speaking, it was a 30-minute education session. And they went over a few different topics. So they went over why your knee is hurting. So some basic anatomy, not really in depth. If you guys want to see the exact pamphlet they gave to patients, I'll put a link in the show notes so you can check it out, right? It's going to be in the guide to patellofemoral pain. They also gave some information about pain management. They talked about how to modify physical activity using pacing and load management strategies, and also information on optimal knee alignment during daily tasks. So basically avoiding knee valgus, right? That was the education group, found to be more effective than wait and see. Also effective, exercise therapy. We know this. Generally speaking, exercises targeted towards the knee, hip, foot, and trunk are helpful. Blood flow restriction training is helpful for knee pain. Aerobic exercise is helpful for patellofemoral pain. And in all of these studies, they basically use a combination of different types of exercise therapy. Okay. Generally speaking, most of these studies combine hip and knee strengthening. And this is because we have some research to show that if you combine knee strength training with hip strength training, you have superior results compared to doing just hip strengthening or just knee strengthening. Okay. In a lot of these studies, it was piecemeal, right? So they may have done knee strengthening, hip strengthening, and BFR. They may have done knee strengthening, hip strengthening, and foot strengthening, right? So again, this was a big study. They combined a lot of research, and they were just looking at what was helpful, and a lot of things were helpful, okay? Another thing found to be more helpful than a wait and see approach was using a foot orthosis, right? And these were prefabricated orthosis. They weren't doing any custom molding of people's foot. They were just giving them something off the shelves. And they also combined the foot orthosis treatment with education. So the same things we just talked about previously. And this was actually more helpful for folks than a wait and see approach, okay? Even though this wasn't a particularly active form of treatment, right? We gave people some education, then gave them a foot orthosis. It was still helpful, okay? What else is helpful? Patellar taping and mobilization. Okay, so a lot of folks will be surprised to hear that maybe some manual therapies or more passive treatments like patellar taping can be helpful. And from what I've read in the past, these treatments tend to be more short-term in nature, not necessarily the best treatment for the long term. But if you combine taping and mobilization with exercise, orthotics, and or education, you actually do get a pretty good long-term effect, right? And again, in this study, they were looking at a lot of different studies and combining them and trying to figure out what was most helpful from a treatment perspective. So these studies used a combination of everything. It was piecemeal, right? Some included some orthosis with education. Some was patellar mobilization and taping with exercise. Some was just exercise. So it was a smorgasbord, really, okay? But all of these things were helpful and effective. So here's the thing. We know all of these things were better than wait and see. What was best? What was the most superior treatment? Okay. So here's what was kind of cool. All treatments had similar outcomes at 12 months compared to wait and see. Okay. So if you give someone a foot orthosis with some education, you have the same outcome at 1 year compared to giving them a bunch of hip and knee strengthening exercises. Okay. So the more passive treatment of giving an orthosis with some education performed at the same level as exercise. Okay. I think that's important to understand because we often think that exercise is always superior. At least in this study, it doesn't seem that way. Okay. However, if you look at the results at 3 months, exercise and education seem to be superior than the other treatment groups. Okay. And there's a lot of strategies to choose from. Like I said before, these studies were kind of a smorgasbord of exercises. So as long as you're doing some hip and knee strengthening, you can probably plug in some foot strengthening, maybe some core strengthening, whatever else, and you'll see a pretty good improvement in pain, better at 3 months than the other treatment groups. Okay. So that's what's helpful about the active group. It tends to give better short-term effects. All right. And the last piece was that wait and see was not helpful. All right. So in some conditions, maybe we can let people have pain for a longer period of time. Generally, it tends to get better. We can tell them it tends to get better. At least with patellofemoral pain, it doesn't seem to be the case. All right. So if you're diagnosing someone with patellofemoral pain, they're probably not going to regress to the mean and get better over the course of time. So the wait and see approach, not recommended for these folks. We probably should intervene. Okay. Makes sense to me. So here's what I want you to do next, guys. If you enjoyed this video so far, I have an entire course. It's free. It's called the Fitness Pain-Free Mini Course. And we go over 3 lessons going to help you take a lot of this information that we went over so far and put it into practice. The first lecture is called Why We Need a Better System. So first and foremost, the way we treat fitness individuals, all right, athletic people in the gym from a physical therapy perspective is pretty much broke, okay? So we need a better system to serve the folks that are in the gym, that get hurt, they want to get back to training, all right? Lecture number 2 is called 7 Reasons Why People Get Hurt in the Gym. And essentially, we have to know the reasons why people get hurt in the gym so we can keep them safe in the future, right? And when they get hurt, we have to know why and how to get them back to training in the gym. Okay. So a thorough understanding of this is very, very important. I actually have a really cool infographic that goes along with this lecture that you get for free as well. And lastly, we go over a case study of how to get someone out of pain and back to training. So these principles are all phenomenal, but we don't actually put it together and you don't understand how to create a program to get people back in the gym and keep them safe for the long term, then we lose, right? So I'll put a link in the show notes for this. It's a fitness pain-free mini course. Definitely check this out.